Over the recent years, I think you probably agree, and we've spoke about this before, that we have seen a huge change, both in terms of policing, the family ethos of looking after each other, I think has massively improved over the last, certainly over the last decade, but over the most recent years. What are your views on that? Do you think it's on a trajectory that's going to keep improving? Do you think there's an awful lot of work still to do? And specifically with mental health as well. I mean, you know, there is a lot of work to do constantly with mental health. I love the fact, and I'm really grateful for the fact that now that the stigma seems to be a lot less than it was, and people do feel a little bit more confident in speaking about their mental health. But do you think we're there yet, or do you think that trajectory's got to still keep rising?
Yeah, well, I mean, we've been on this journey together, haven't we, for many years? And I think, we've got the evidence to show that the stigma is reducing. Your own survey said a big uplift in people feeling confident to talk about the mental health at work. Now then, once you've asked people to stick their hand up, you've got to have the services ready. You've got to have the line management support there, and you've got to have ownership from the top of the organisation right the way through, to make sure that when you do stick your hand up, you get the right support. Or else what happens is people go, hold on a minute, you've been telling me for years, talk about mental health, and now I've got a 6-month waiting list for counselling. So I think where we are at the moment, I think it's caught a few people off guard, how ready people are to talk about mental health. And that's created a pressure on some services like occupational health. In my old force, we went from something like 350 site referrals a year for counselling. That's a workforce of nearly 6,000, where over 2 years it went to over 1,000. Now, if you haven't invested and got good people in doing your counselling and the specialist trauma support counselling sometimes you need, then that's now settled down to about 650 a year. But the waiting list is like 2 weeks. So people are putting their hand up earlier, Hayley, they're getting good support and they're going back to work. What we found initially is people who haven't spoken about mental health for decades were presenting with quite critical issues. And you've got to work through that and be confident. And I think where we're on our journey at the moment is that we are supporting forces to work towards occupational health standards, which we've published. We're working with all the forces in the country with specialists in officer kilo to assess where everybody is against those standards and help them get where they need to be. Some of that will be a conversation within the organisation, say, well, we need to spend a bit more money on this, or we need to do some change about how we're structured around our services. So that's where we are, I think, on our journey. I think our people have done exactly what we've asked for them. A lot of them, they're starting to go, I'm struggling a bit. You better be ready to step up and support them with the right services.